My left cheek looks totally different than my right cheek, and it really bothers me. How can this be treated? Is it a bone problem or a fat problem? I am currently now at a body mass index of 27, and I am planning to lose more weight. Will this solve the problem?
Thank you for your question. You submitted a single photo and you state in your question that your left cheek is completely different from your right cheek. And you're wondering whether it's the bone or whether it's fat or both. And to go on, you also mentioned that you were planning to lose more weight and you want to know how to fix this problem. Well, I can certainly discuss this question with you based on the type of approach I have in my practice for similar situations. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And I can tell you that this concern about symmetry is a concern that pretty much every patient has to some degree or another, whether they're interested in eyelid surgery, facelift surgery, or injectable fillers, or anything else. They're always aware that there's a difference between one side and the other. They can't always understand exactly what, but certainly they recognize there is an asymmetry. So what is the basis for this asymmetry? Well, one simple basis is the fact that most people are genetically asymmetric to some degree. Some people are more asymmetric than others. And basically, when you think about one side of the face from the other side, there is a relative microsomia, or just a little bit less projection of the bone structure on one side compared to the other. So it's very common to have one cheekbone more prominent than the other, or the projection forward being different from one side or the other. So basically the foundation is the bone structure. Now, above that bone structure is, of course, the muscles, the fat, the skin, the soft tissue, essentially. And so in a situation like yours, understanding that you are planning to lose more weight, there is a high likelihood that there will be a change in the relative volume of cheek material or mass on the right side. And you may get some degree of relative symmetry because the right cheek looks a little bit more full than the left cheek. Now, very often when people are losing weight, as long as they are within 5 to 10 pounds of their ideal body weight, it is usually at a place where they are going to be steady for a long time. Unless they're somebody who is more of an athlete who does things like marathons and or triathlete, or someone who really burns a lot of fat and has very low percentage body fat, most people with regular work and regular lives and relatively good diets usually float somewhere around 5 to 10 pounds of their ideal body weight if they're into fitness. Now, that being said, that usually means there is some degree of fat in their face, which is normal. So when it comes to trying to balance things out, we usually do some variation of use of fillers. And these fillers can be placed at different levels in the face. And one area that we really find very helpful is a technique called structural volumizing. In structural volumizing, we're actually placing a filler, a thicker filler like Juvederm Ultra Plus or Juvederm Voluma, at the level of the bone. By doing that, we're able to place it under the muscle and, in fact, restore or augment the volume at the bone level, which means to a degree we can compensate to some of that asymmetry, where there is a relative deficit on one side compared to the other. Now, we can also place the volume in the soft tissue, but as a general rule of thumb, when it comes to the cheek, I try to do more at the structural level because then it is more stable and the muscles and the soft tissue glide over that material, as opposed to placing it in the soft tissue where the volume has to be limited to a certain amount before it creates a weight or pushes down or spreads out or may look a little bit irregular. There is an art to the placement of fillers, and there's also an art to choosing the type of filler. We're actually living in a very, very good time in the world of fillers because for example, the hyaluronic acid fillers, whether it's the Galderma family of Restylane products or the Allergan family of Juvederm products, we have a lot of options from different viscosities, different particular properties, and different ways to actually apply these fillers. So with this comes a lot of flexibility, but further requires a true understanding of the art of placement. I can't tell you how much every day in our practice people come in who, when we're discussing fillers, they always talk about how they don't want to look like such and such or so and so because they don't want to look ballooned or unnatural. But I always point out to them is that what you don't know is the people who look good and have fillers because they look very natural. So that again is about the art of placement and the art of understanding the proportions. Something like the golden ratio where there's a natural balance to the face that you want to achieve to maximize an attractive look regardless of ethnicity, which is remarkable. The golden ratio is almost universal. So that being said, I think it makes sense for you to meet with a qualified, experienced doctor who does a lot of these fillers, who you feel is able to understand your concerns and see what kind of strategy would work best for you. I think it's very important that you get comfortable with one doctor who you feel really gets what you want and is able to achieve. And that's, for me, in my practice, I spend a lot of time with every patient. I take their pictures, I put them up on the screen, and I look at them very critically, and we look together and we plan things out. And I treat fillers pretty much the way I treat surgery. It's all about really good planning, markings, and placement, and then achieving the optimal balance. Not to mention we follow them up in 2 weeks to check to make sure that everything looks good, or if an area needs to be tweaked, that it can. So again, meet with qualified, experienced physicians who do a lot of fillers. Discuss your weight loss plan and see how that fits in the context of your concerns, and then move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.